Katarzyna Lion, who's a postdoctoral research fellow at the University of Griffith, who's going to talk with us about some of the benefits and challenges of accessing long-term psychosocial support for people with brain tumour and their family members.
Hello, everyone. Thank you for joining us here to hear about our research. And I want to talk about the study we conducted as part of the BRAINS program, in which we tried to unpack how people with brain tumor reach psychosocial care in Australia. And we did a qualitative inquiry to do that. So we know very little about psychosocial care pathways in Australia. And we currently know that they vary according to the brain tumor characteristics and social characteristics of people. We know that the way healthcare professionals provide care also depends on their discipline, if they are psychologists or nurses. It depends on the stage of illness. People receive different access to care when they are firstly diagnosed, during the treatment, and during the survivorship phase. And we also know that it depends on the setting. So people in oncology settings are usually better connected with psychosocial care. However, we wanted to look deeper, and to do it, we conducted interviews with healthcare professionals. We spoke with 21 interdisciplinary healthcare professionals who regularly provide support to people with brain tumor and their family members. You can see that we included psychologists, nurses, other allied health professionals, medical radiation oncologists, also advocacy workers working in the community, and 4 of our interviewees were care coordinators. You can see that we reached people from majority of Australian states. However, we had no luck to reach someone to speak to from Northern Territory and Tasmania. And you can see our topic guide. So we looked into healthcare professionals' demographics and their work characteristics. We looked at their scope of practice, their role, and their clinical setting. And we also asked them, and that was our main reason for speaking with them, their perceptions of scope, gaps, and limits within the psychological and emotional support within their service and their role within the context of their workplace and their state and territory. So how we analyze the results? We use the thematic analysis, which looks into transcribing the interviews, then coding them separately, looking into what common themes and categories are coming out of the interviews. In the first theme, we looked into challenges in fitting people into the care system within the existing pathways. And in the chart, you can see the visual overview of the differences in access to psychosocial care across different types of brain tumor, with people diagnosed with benign tumors more relying on community access and community services because they don't fall into typical cancer oncology services. We also looked at people with lower grade gliomas who are also not as well connected with services as people with high grade gliomas, and that corresponds with what Dai was speaking about in her first presentation today. In the second theme in our research, we highlighted the importance of longer-term care coordination and interdisciplinary connection. We looked into the fact that those people who are connected with the care coordinator, who is responsible on regular checkups and work in the big oncology centers, those people usually receive better care and access to the psychosocial care across their trajectory. However, what was really important in our research was the fact that a lot of care coordinators mentioned that they didn't realize when they were starting their job the emotional load coming within and they felt like they were not professionally trained for that part of the role. And the third theme, which corresponds with a lot of presentations today, is about how brain tumor affects the whole family. So it's not just the person with brain tumor who is affected, but the whole family system, in a way that the finances changes, the role in the family changes, and the fact that there is usually a caregiver who takes a big responsibility to support the person diagnosed with brain tumor. And unfortunately, we don't have many resources and services supporting the family itself across the journey trajectory. So we see that the psychosocial care is very closely linked to medical interventions in Australia and may not be really available to everyone that would benefit from it, especially those with non-malignant tumors at the beginning of their journeys. And we see that there is a need for improved access to care coordination and to access interdisciplinary psychosocial care, which is tailored to the needs of individuals with brain tumors and their families. And maybe there is a way of looking into a slightly different models of care, especially for those people who don't need all those medical interventions, like people with non-malignant brain tumors. Our study has already been published, so you can access the full paper with the QR code. And if you want to hear more details, please feel to reach out.